Doctor, good morning to you. I've just taken a look at an article written about you, an interview that you did with a local newspaper about the work you were doing as to how to prepare expected mothers about getting into hospital to have their babies delivered. But what I find fascinating, Doctor, is my question to you. You put this plan in place 2 weeks before the pandemic even hit. That's the kind of forward thinking that puts you at the top of your game. Congratulations.
Thank you very much, Gareth, and good morning to everyone, and thank you for the opportunity once again.
So tell me a little bit about this plan that you put into place, because I imagine an expectant mother and father and family members probably won't have a very good idea what to do when they get to the hospital during COVID-19. How different is it to the regular patients?
So it's really very different, especially since we're looking after a very vulnerable group, being the pregnant mother, her unborn baby, and not forgetting the family, which now during 2020 has been impossible in terms of keeping the unit together because of infection control. So the thought process at the beginning of this year was to identify that there was a disaster and that we needed to manage that accurately and as quickly as possible, and putting strategic plans into place to try and protect not only the mother, her unborn baby, but our healthcare workers as well. So prior to the pandemic, we started looking at ways in terms of maneuvering certain services within our department and looking at where our focus needed to be, and at the same interim also acknowledging that we were an essential service and that babies were going to be delivered throughout the year. They didn't abide by lockdown rules or certain levels, and because of that we needed to have a plan in place that made it worthwhile not only for the healthcare facility to look after these patients, but made it safe for them to come into our facility. So social distancing, hand hygiene, and education, and the use of masks, especially in the pregnant population, was introduced very early in the pandemic. And we've learned so much in the first wave that, as scary and as disappointing as it is that we are hitting into the crux of the second wave, we've learned a lot to help us adapt with what we need to do to protect this vulnerable population.
There's a couple of questions that I picked up on social media, Dr. Burra, if you don't mind me asking those, and these are just from members of the public. Many, from what I can understand, are pregnant, so they're expecting to deliver their little bundles of joy in the next month or two, so they're right towards the end of their pregnancy. Maybe you can help me understand and maybe answer some of their questions. If an expectant and a pregnant mother is pregnant, I beg your pardon, of course she's pregnant, has got COVID-19 on the day that she has to come into the hospital, either for a C-section or a natural birth, but she is COVID positive. Is she allowed to come to the hospital? The second question that I think many women are asking on social media is, do you have to wear a mask during childbirth? It doesn't seem like a very serious question, but for a mother giving birth, it's a very serious issue, isn't it?
I think those are very relevant questions, and I think those are very responsible questions to ask, to equip yourself with what the expectation is at the delivery, and to basically train yourself in terms of how you are going to deal with what seems unnatural now, because it's not something that we're used to. From a healthcare perspective, we have a knee-jerk reaction when a patient is has been confirmed as COVID-19 positive, and the right protocols are put into place. To answer your first question, in terms of if a mother is confirmed to be COVID positive and what is her response then in terms of continuing her health care, I think it is to firstly report or to disclose the status to your healthcare provider so that the correct and contingency plans can be put together in terms of the healthcare worker making sure it is safe for you to enter the hospital without being exposed to other mothers who are, COVID negative or who are well. It is then to be able to assess the severity of the disease process. It's able to assess to protect you further from contracting any other, viruses or illnesses or being compromised in any way. So presenting yourself to the healthcare facility for a delivery and for antenatal care is vitally important. We will take the necessary precautions to keep ourselves safe from contracting the virus from you and to keep you and your family members safe as well as the rest of the patients. So staying at home and avoiding or not attending a healthcare facility to make sure that the delivery is safe and to make sure that you are safe during your pregnancy is vitally important, that you do seek that help, and so the correct measures can be put into place. To answer
yes, go ahead, Doctor. Sorry, briefly, if you could, that last answer of yours.
So in terms of the second question of wearing a mask during delivery, we do advocate that all of our patients that are admitted into our facility and those who are going in through the labor process as well as the cesarean section are provided with the surgical mask. During the labor itself, we do have criteria in which we have a barrier precaution between the laboring mother and the midwife or the delivering attending clinician that protects from any droplets or spread basically coming through onto the healthcare worker. We do not allow, unfortunately, any support during the delivery because of the risk of infection, but we do provide a second midwife or a second healthcare worker to assist the mother during the delivery, which I think is also very important. So there are plans put into place, there are structures that have been met, and we have a delivery suite that is specifically for patients who are true patients under investigation, where we are waiting a result, or those who have been confirmed. And we also have pediatricians on standby who will be attending at the delivery to make sure that the baby is in a safe place and has been evaluated. In terms of cesarean sections, there are criteria and protocols that we follow in terms of standard operating procedures in our theaters. A theater is designated for a mother who is COVID positive, and she would have the appropriate staff who are trained to conduct and continue with the cesarean section, from the midwifery to the anesthesia as well as to the surgeon, and then the collecting of the baby. We've become very good at foreseeing when this needs to be done, and essentially a theatre is constantly running under COVID regulations.
It really looks like you're on top of your game and what is happening at Charlotte Maxeke General Hospital. Dr. Shastra Bura, it's been a pleasure speaking to you. Congratulations on having these plans in place weeks before COVID-19 hit. And for all those expected mothers who had those questions that I asked, yes, you will have to wear a mask during childbirth. And should you come through to the hospital, if you're COVID positive, you need to contact the facility where you're expecting to deliver your little one.